I'm Dr. Stephanie Martin, maternal fetal medicine specialist and medical director at Clinical Concepts in Obstetrics. Let's review our definitions of preeclampsia. Preeclampsia is hypertension with protein in the urine, and the hypertension is further defined as systolic blood pressures of 140 or greater, diastolic blood pressures of 90 or greater that occurs after 20 weeks gestation. These blood pressure elevations need to be sustained at least 4 hours apart on 2 separate occasions. But if the patient has severe hypertension, you do not need to wait for the 4-hour apart to confirm the diagnosis or to treat. Proteinuria is defined as a urine protein to creatinine ratio of 0.3 or greater, or a 24-hour urine collection of 300 milligrams or greater. If neither is available, then you can do a urine dip and you'll demonstrate 2+ proteinuria on that sample. This is not the preferred method of confirming proteinuria. It is possible for a patient to have preeclampsia without proteinuria, and in that scenario, you would need to have hypertension plus some evidence of end organ dysfunction. This could be with laboratory abnormalities such as thrombocytopenia with platelet count under 100,000, a serum creatinine level above 1.1, or doubling from their baseline creatinine level if that's known, and doubling of the AST and ALT from the upper limit of normal. There could also be symptoms such as pulmonary edema, refractory headache, or visual disturbances. For a patient to be considered to have preeclampsia with severe features, she essentially has preeclampsia with any of these features that would then make it severe, such as severe range blood pressures with systolic blood pressures of 160 or greater, or diastolic blood pressures of 110 or greater, abnormal labs, including thrombocytopenia with platelets under 100,000, elevated liver function tests twice above the normal with respect to AST and ALT, and no other explanation for those liver function elevations, and an elevated creatinine level of 1.1 or doubling of baseline without another explanation. You can also have symptoms which would classify as her having severe features. These include refractory headache, new onset of visual disturbances, pulmonary edema, or refractory right upper quadrant or epigastric pain. There are significant maternal and fetal risks that the patient is presented with when preeclampsia is diagnosed. For the mother, she's at significant risk for cerebral vascular hemorrhage, particularly with evidence of severe hypertension. Pulmonary edema can occur, acute kidney injury, liver rupture, placental abruption, eclampsia, and even death. The fetus is at risk for fetal growth restriction, decreased amniotic fluid known as oligohydramnios, and preterm birth, either because of preterm labor occurring or commonly because of an indicated preterm birth due to the development of preeclampsia. A key thing to recall is that preeclampsia is about much more than just elevated blood pressure. This is a multi-system disease. It impacts the entire body.